And we're now going to move on to our next panel, which is knowing what's in your food, bringing nutrition education to the community, and empowering consumers to make and have access to healthy choices is the third pillar of the White House Conference on Hunger, Nutrition, Health that we are addressing right now. So I'll pass it on to DeAnna, who is going to be introducing our panelists.
So this panel aligns with the third pillar of the White House National Strategy on Hunger, Nutrition, and Health, empower all consumers to make and have access to healthy choices. We will focus on work done in different community settings and where people can learn about nutrition and making healthy choices. So some goals under this pillar include promoting breastfeeding. So create and invest in programs that promote human milk feeding, so WIC, or expand breastfeeding support and counseling for mothers. Support robust and tailored nutrition education, develop a front of package labeling system to quickly and easily communicate nutrition information, and reduce marketing of foods that do not align with the latest dietary guidelines of Americans. So our panelists today includes New York State Senator Gustavo Rivera, Dr. Jean Cadenhead, who is the Executive Director of Teachers College, Laurie and Tisch Center for Food, Education, and Policy. We also have Theresa Landau. Sorry, everyone. So Theresa Landau, which is the Program Director of Morrisania WIC. Dr. DeAnna Nara, the Senior Policy Associate for Center for Science in the Public Interest. And Aleyna Rodriguez, the Executive Director of the Mary Mitchell Family and Youth Center. So without further ado, I will now pass it on to the New York State Senator, Gustavo Rivera, who will share some of the food policy bills in New York State.
Good morning, everyone. This is State Senator Gustavo Rivera. I am an audio, as you obviously can't see me. I am on audio because life intervenes. For those of you that probably know, that some of you might not know, but last year's redistricting put me in a situation where I had to move by November. And so the move happened yesterday, but I am still in post-move situation. I'm currently walking around in my old apartment, making sure that the last bits are cleared out. So no internet, so no video. But I wanted to jump on here, even if briefly, because I believe that this is a very important conversation. The reality is that, as you've heard from the last couple of panelists, there's a lot of work that is being done in communities all across the state and the country around educating folks to what's actually in their food. There was a whole conversation about how certain communities and certain cultures have known that food can be something that keeps us healthy and that makes our lives better. But when you take into account that there are enormous companies that make enormous amounts of money by selling us and selling to particular parts of our communities things that are very profitable, but certainly not very healthy. As I'm sure that there will be plenty of conversations around how high content, high fat content, high salt content, and high sugar content are things that are endemic in so many of our food. And then we have, because these things they make us feel good, and for these companies, they're incredibly profitable. So I think it is important to make sure that people know what is in their actual food. And so there's a couple of pieces of legislation that I sponsor, one in particular dealing with sodium, dealing with the amount of sodium that is in people's food. And the thing that's important to understand here is that, listen, I am not going to say that I eat nothing but leaves and water and healthy all the time. Certainly, I make some unhealthy choices now and then, and sometimes we all do. But what is important here is that for everyone to know what it is, to be educated about what it is that they're putting into their body. And these bills are resisted by certain folks who would rather you not know that those things that you are putting into your body greatly exceed the amounts that everyone agrees is a healthy amount of sodium to put into your system. So I think that, it's the most important part here is that there is some there's a legislative piece here, there's a community piece, whether it's community organizations, whether it's healthcare providers, community groups, but there's certainly a legislative piece. And in my case, what I remain committed to is making sure that we can be thoughtful about legislative approaches that help to educate the public about what's actually in the food that they consume, so that they can make better choices. And then hopefully that will lead to lower caloric intake, lower sugar intake, lower sodium intake, which ultimately leads to better lives to individuals and to our communities being healthier as a whole. So I certainly remain committed to continuing to do that. As I continue to deal with post-move madness, and as I say thank you for inviting me to be part of this conversation, and very much looking forward to be able to see you folks when I set up in my new place with internet and everything else, and continuing the work that we're going to do legislatively to get these bills passed in the years to come. So thank you.
Thank you so much, Senator Rivera, for taking the time and sharing that with us. Yeah, if anybody has any questions, we'll come back to it towards the end. And I wanted to pass it on to Dr. DeAnna.
Thank you, DeAnna. And I'm just going to share my screen. I have a couple of slides. Yeah. Okay, can everybody see that okay, DeAnna? Okay, yes. Perfect. Okay. Well, good afternoon, and thank you so much to Bronx Health Reach for inviting me to speak today. I'm going to cover some labeling and marketing policy opportunities that help to encourage healthy food choices and also enhance transparency of nutrition information for consumers, exactly what Senator Rivera just touched on with his groundbreaking legislation. Sorry, here we go. Before I get started, I just want to briefly introduce my organization, Center for Science in the Public Interest. For those who are not already familiar with us, we are America's food and health watchdog, founded in 1971 with a nonprofit mission of consumer education and advocacy. We are an independent consumer voice and maintain that independence by not taking money from food companies or government. And I just want to kind of start off with thinking about and centering around food environment policies. So neighborhood and community food systems play a major role in how people interact and engage with the food systems. Places like grocery stores, convenience and corner stores and restaurants all are part of the food systems that people purchase and eat from. As people interact with these environments, other factors such as learned food preferences, the social environment, eating behaviors, and health status, all of these are going to impact purchasing choices within these systems. And we know that policies that impact the food environment can influence the food system in several ways, and ultimately impact consumers' food choices as well as diet quality. Policies that target labeling and food marketing can enable healthy preference learning. It can help overcome barriers to the expression of healthy preferences, things like income and time poverty. It can also encourage people to reassess at the point of purchase, so when we're checking out at the register. And it also can promote a food systems approach. And why do we need policies that address the food environment? I think we're all talking about that today, but we know that the most recent dietary guidelines for Americans show that adults and children in every single age group from the age of 2 to 60 plus years are regularly exceeding the daily limit for added sugars and sodium. So the things that we are currently doing are not working. With restaurant foods and processed packaged goods accounting for much of the sodium and added sugars that we consume, we have over 70% of the sodium that Americans eat daily that's being consumed at restaurants or from processed foods rather than foods that are prepared at home from scratch. And in the US, we know that sugary drinks are the top source of added sugars in the diets of adults and children aged 1 or older. When we start thinking about these food systems, restaurants play a major role. We know that the restaurant industry feeds a meal to more than 1 in 3 Americans each day. And the context for food environment policies is that companies, particularly chain restaurants, have worked for years to normalize this extreme consumption, creating meals that can exceed or approach an entire day's worth of added sugars and sodium in 1 single serving. This is the average profile of the average default combination combination and default, we say you're medium size. In the US, which holds 60% of your daily value for calories, 92% of your daily value for sodium, and 68 grams of sugar, which accounts for 136% of your daily value for added sugars just in one meal. Fast food restaurants are disproportionately located in under-resourced communities, with predominantly Black and Hispanic communities facing higher exposure to fast food, a product of residential segregation that is rooted in historic policies such as redlining, disinvestment, and targeted marketing. In 2021, we published this sweet excess report to assess how a warning for a day's worth of added sugars could apply to restaurant menus. And what we found actually surpassed our expectations for how much of this is actually in our restaurant meals. We focused on the leading chain restaurants that carry full calorie sodas, mainly because the added sugars equal to the total sugars for this product. We looked at the various sizes: small, medium, large, extra small, and even kid sizes. And what we found that was all sizes except for kids, the median was higher than the daily value. So even looking at the small beverages, in 13 of the 17 chains offering that size offered more than an entire day's worth of added sugars per cup. We did also have one kid-sized beverage that had more than an entire day's worth of added sugars for adults. This just speaks again to the extent to which the food industry has normalized overconsumption. So even when consumers think that we are choosing modest portions, we are getting way too much sugar to align with trying to maintain our health. So nutrient warnings are a tool that we can use to help. So nutrient warnings are disclosures that can be considered as a form of nutrition education. They appear on menus, menu boards, food labels, and on the front of packaged goods in other countries, and provide easily interpretable information to consumers about food and beverage items that contain excessive amounts of harmful nutrients like sodium and added sugars. We know that these are objective, they're very accessible, they're also widely supported, and they can help individuals identify and avoid foods with excessive amounts of sodium, added sugars, and other nutrients of concern. Policies that require warnings on foods and beverages that are high in sodium and added sugar can benefit community health because it nudges people towards healthier choices. It also increases access to information and also pushes companies to actually reformulate their recipes and products. So companies will reformulate to avoid a warning. So if the warning is a cutoff of added sugars at 50 grams or your whole entire day's worth, and their products go over that, they will reformulate to get under that threshold, which consumers benefit from and didn't have to actually do anything to participate in that change. So we have two different ways that we see nutrient warnings being used. So nutrient warnings on menus, and most of us in New York City have seen the sodium warnings, right? So these are disclosures that will appear on the physical or online menus, menu boards, and these provide really easily interpretable information about these menu items. And so it's just from a glance, you can take a look, you can see, I don't think I want to eat an entire day's worth of sodium in one of my dishes, or I don't think I want to drink an entire day's worth of added sugar, or 2 and 3 times a day's worth of added sugar in one medium fountain beverage. This also helps to supplement the nutrition information that's already required, such as calorie disclosures, because they don't signal nutrient quality on their own, right? So we don't know about sodium, added sugars, and all of these other pieces when we're just thinking about that nutrition information. Some of these examples include the sodium warnings in New York City and Philadelphia, as well as the most recently passed added sugars warnings on prepackaged items in 2021 in New York City. The other space that we find nutrient warnings, and this is the case for other countries, not the US yet, but I am going to talk about some hope there. So front of package nutrition labeling. So this uses interpretive aids like symbols or colors to enable consumers to quickly and easily understand the healthfulness of different foods. There are several different types of front of package labels. There's nutrient warnings, which is specifically what we're talking about. And some of these front of package labels can appear only on the healthiest foods, so things like healthy choice check marks, etc. And so generally different types of labels across the world globally. We have a growing body of evidence that, and this is from international evidence because we have some First Amendment challenges here in the United States that we are contending with, but they are a very effective tool for public health. Chile actually adopted warnings on the front of packaged foods, and that was passed in 2016, and we saw dramatic declines in foods bearing warnings after the policy went into effect. Some of the biggest impacts that we saw were on sugary drinks, and sales for these types of beverages dropped nearly 25% in the 18 months after Chile actually adopted these warnings, which is a very exciting statistic. And as I touched on earlier, I'm just going to cover, so predatory food marketing tactics are something that the industry uses to target vulnerable groups like children and older adults, to mislead them into thinking that their products are healthy, part of a normal diet, but we know that that is not the case. And restaurants and food companies are a top marketer to our children and our teens. I'm a mother of a 12-year-old and a 14-year-old, and I have heard about products that I've never even heard about, just by them going to school. And being influenced. They call me the sugar police, so I don't have much say, but hopefully one day. But we know that they're aggressively marketing to our children, and they're aggressively marketing to our children in several different ways. They're being inundated on tech, on the phones, on the computers, even advertising while on learning platforms at school. And according to the Federal Trade Commission, we know that food companies spent nearly $2 billion marketing to youth. And we know that these numbers have even increased from then. We also know that misleading food marketing negatively impacts population health. Through marketing, the food industry has a heavy influence on all different types of environments where people are making these purchasing decisions. And we also know that, again, excess consumption of foods high in calories, saturated fat, and added sugars can severely impact children's health. It also impacts our children. The effects of advertising impact our children. So for young people, we know that this kind of marketing and fast food advertising around processed food can be very, very much so harmful. It can actually activate very sensitive and developing neural pathways that actually can shape behaviors and choices really down the line. We know that product preference has been shown to occur with as little as one single commercial exposure. And we know that this also affects the purchases and purchase requests that they want and ask for from their parents. So we know that policies that restrict this type of marketing and promote healthier advertisements or require nutrition standards around advertisements are a tool that we can use to counter some of these predatory practices. And just as a quick kind of tie back to what we're doing, as Senator Rivera discussed earlier, we are currently working on several policies at the state, local, and federal level that are focused on labeling and marketing, our nutrient warnings in chain restaurants with sodium and added sugars policies. We are working on, again, Sweet Truth is the bill that we call this, and this is our added sugars warnings bill at the New York City level, as well as at the state level. We have a sodium warnings bill at the state level, and those two bills are what Senator Rivera was discussing earlier. We have a restriction of food marketing to children bill known as the Predatory Marketing Prevention Act with Senator Myrie and Assemblymember Reyes. Oops, sorry, we're going forward too far. And then we have at the federal level, we have labeling of prepackaged goods, and we have two things moving there. And I will just quickly touch on these. So INT 687, this is our New York City Sweet Truth bill. We had a first version that passed, a watered down version in 2021 that only covered warnings on prepackaged items. Thank you to industry interference at the evening before we passed that bill. But with the communities, we came back, and that was a year ago. We reintroduced to extend these warnings to cover all menu items at chain restaurants with 15 or more locations. And those are menu items that have more than your entire day's worth of added sugars. So that is now moving through the council, and we are hoping to be passed very soon. And the other, obviously, state bills that I already discussed. On the Predatory Marketing Prevention Act, this is an act that we are working on, and we will be reintroducing, well, revamping and bringing back up in January. And this addresses false and misleading advertising of food products. This is already illegal under the New York State consumer law currently, but it will expand that definition to include a false and misleading to actually include advertising of unhealthy food, specifically marketed to young people and other vulnerable groups. With this false and misleading guise, the AG can actually sue. And this actually also increases the damages for food companies that target our New York children and other vulnerable groups with this false and misleading advertising. And this would be the first marketing act that's passed in the country. So on our federal side, we have our Truth in Labeling Act, and this is going to be the one that amends the Federal Food, Drug, and Cosmetic Act and requires standardized interpretive nutrition labels. And this helps to clearly distinguish between foods of greater or lesser nutritional value. And again, this is those front of package warnings. And we are, looking at labeling, including calories and interpretive information with those warnings, nutrient warnings, that will indicate to consumers what high levels of added sugar, sodium, saturated fat, and any other nutrients that will help people select and make healthier choices. The Food Labeling Modernization Act, also known as FLMA, that amends the FFDCA to actually align with the latest nutrition science. It also strengthens those labeling requirements to align with our public health priorities. And these are both going to be actively moving. The Truth in Labeling bill should be introduced very soon. We're hoping in the next month at Congress, but that is actually moving through FDA. And we're hoping to see a rulemaking on that by December. And this is just some of those comprehensive changes to food labeling that the FLMA puts into place. We have triggering reformulation, countering misleading claims, a whole host of different things, enhancing transparency around several things, colors, flavors, caffeines, allergens, sugar, alcohols, and increasing access to information. So sale of foods online, ingredients, and establishes a public online food label database. And I will stop there and stop sharing my screen. Thank you so much.
Okay, thank you so much. I'm sorry, am I frozen for people?
We can hear you.
Okay, I'm good. Awesome. Thank you so much, DeAnna, for that. And I'm going to pass it on to Dr. Jen Cadenhead.
Hi, everyone. I'm so honored to be here. I think it's been just a fascinating conversation with all the stakeholders and the community members, and I appreciate the welcome. I'm Dr. Jen Cadenhead. I'm a research assistant and professor in the program in nutrition at Teachers College, Columbia University. And a lot of people don't know what that means, but it's Columbia's Graduate School of Education, Health, and Psychology. I'm also a registered dietitian and behavioral scientist, and I run a center dedicated to research to help advocates create policy to be able to have people access and eat healthier foods in communities so folks can live healthier, more equitable lives. It's called the Laurie and Tisch Center for Food Education and Policy. My particular area of expertise focuses on diet quality and ultra-processed foods and health outcomes, and it's especially in children. And like Mayor Adams, who I think many people have heard his story many times, I also was evangelized due to a health issue, and then dietary change made a huge difference in my life. And as one of the gentlemen earlier mentioned, even behavioral health issues can be highly associated with what people are eating. I think both Senator Rivera and Dr. Nara both alluded to the food environment that we have. Americans get over 60% of their calories from ultra-processed foods, and a lot of people don't even really know what that means. We also know that eating less processed foods, more minimally processed foods, is associated with having longer, healthier lives. This is becoming more established science, actually. And we know that children who eat healthier foods for longer actually grow up healthier in many ways, including better brain development because of the nutrients that are needed for all of those things. But eating healthier foods leads to longer health outcomes too. Like New York City was the epicenter pretty much of COVID, and all of those things. I don't think we've emphasized it enough, but really do make a difference. And so that's why I do the work I do. But we actually know that people need access to healthy food, as was mentioned with the GusNet program and the produce prescriptions. Many people may not be aware, but there was a law passed in Congress. It's called the Healthy Hunger Free Kids Act of 2010. And the standards for school meals make school meals among the healthiest meals that Americans actually have access to and eat. And New York City has a wellness policy that means New York City public schools are actually even more stringent than national standards for meals. But we have to get people to eat these foods. And to Dr. Nara's point, if you go into any public school, you'll often find beautiful scratch cooked meals. And you'll look at the students, and some of them are eating them. And then other people are making a meal out of, I don't know if anybody wants to throw out an answer there, but the number one thing I've seen, and anecdotally, is Takis and other snack foods. So you have to reprogram taste buds and minds. And that's where nutrition education comes in. So at New York City has been working over time to add more exciting, healthy meal options. But we know that even with these menu changes, you have to pair it with nutrition education to get students to eat new foods in our ultra-processed food environment. So, all the bodegas, all the marketing that Dr. Nara was just talking about is here, and the laws haven't yet been passed. And so we have an oversaturation of things that are actually unhealthy, readily available. So at the Tisch Food Center, we house something called a Food Ed Hub, and it supports a Food Ed coalition. So Bronx Health Reach is part of that coalition. It's a group of New York City organizations and individuals that promote nutrition education. And among the many things we do, we provide resources and support for organizations that provide nutrition education. In 2017-18, we published a study that surveyed the independent organizations that were providing nutrition education in New York City, and we found that there were many communities, mostly in low-income social economic status areas, that have very few nutrition education programs. And to its credit, New York City became even more interested in the effort of making nutrition education and food equity access more available. And this was prior to COVID. So a lot of that effort was actually led by Kate McKenzie, who's now the executive director of the Mayor's Office of Food Policy. And she's been pushing along with all the advocates to get this funding. COVID made it tough for a lot of the nutrition education programs in the city. And so we've been updating that survey that we did back in 2017-18. We're just finalizing the results now. And not surprisingly, COVID actually closed down a lot of those nutrition education providers. And the communities that have the lowest resources, like many things, tend to get cut off first when resources are thin. Fortunately, though, because of the work of all of our partners on the Food Ed Coalition and city investments, the mayor and the city council decided to commit to rolling out nutrition education as part of the curriculum in New York City public schools. And they've created a plan to incorporate it. And they're providing grants actually this year to start a pilot program with an emphasis on equity to get nutrition education into schools. So that's the biggest news of probably many, many years, and I'll leave it there.
Thank you so much, Dr. Jen. So thank you for that. I am going to now pass it on to Theresa Landau. Oh, you're on mute.
Sorry about that. Thank you so very much. And this has been absolutely wonderful. I'm going to just share my screen and make sure I don't share the wrong thing of one of the things I have minimized here. So let me just pull it up. Just to keep me on track, being succinct is not one of my strengths, but I will try my best. My name is Theresa Landau, and I am the director of the Morrisania WIC program, and have been here since, I like to say, the dinosaurs roamed the earth. Next month, it'll be 45 years, and I've been very, very, not only the WIC director, but I've been very involved on the national level with the WIC program and many breastfeeding organizations. So I'm going to try to go fast and have time for questions, and the next speaker as well. So we were involved in the White House Conference on Hunger and had been part of the listening sessions. And the White House Conference on Hunger, Nutrition, and Health outlined the urgent need for a national effort to end hunger and curb chronic diet-related diseases. And the WIC program is very well positioned to make progress on these dual goals through targeted support that enhances access to healthy foods and community nutrition services that help families make these healthy choices. So as the nation's premier public health nutrition program, the WIC program is situated to help advance the crucial conversations that are happening now about maternal health, and also ensure that families have access to proper nutrition. And if you didn't know it, the WIC program provides benefits, which I'll mention in a second, for pregnant and breastfeeding people, infants, and children up to the age of 5 who are at nutritional risk and are not only low income, but in many communities, moderate income. I'm in the Bronx and I'm in the South Bronx, so my population is very poor. So this program has really been a lifeline for our families during a very critical stage of development. And the pandemic, as was said before, made this really clear. We were in a very, very high risk area. So the WIC program just really saved lives. Everything we do, we frame through a JEDI lens. JEDI stands for justice, equity, diversity, and inclusion. And the WIC program, this is just so you have some fun, but the WIC program provides care through 4 pillars. The first one is the one that you all know about, and that's access to healthy food. And by the way, Norma and everyone else, actually, the WIC program was the first food as medicine program nearly 50 years ago, because the WIC program is prescriptive and had the foods that we provide are basically through a prescription associated and accompanied with nutrition, education, and counseling. So we always said that we were the first food as medicine program. The WIC program provides a monthly benefit to purchase nutritious foods that supplement the diets of WIC families, individuals, and young children. And this is known as the WIC food package. And the purpose of the WIC food package is to deliver priority nutrients at these critical stages of growth and development, during pregnancy, during intra-pregnancy, because we go from one pregnancy, hopefully it's a few years to the next, sometimes it's not, and infants and children. And the WIC program has really had a great impact on reducing the rates of prematurity, low birth weight, very low birth weight, infant mortality and morbidity, maternal mortality and morbidity as well. Right now, the USDA is updating the requirement for WIC-approved foods that are based on the dietary guidelines for Americans. And many of you might have written comments during the comment period in November 2022 to February 2023. And we are urging USDA to move fast to finalize these new food guidelines, because it's critically important for our families. One of the important things to know about the food package is this is not your grandmother's old food package. We know about the milk, juice, cheese, eggs, and cereal that the WIC program has provided, but we also provide, since 2010, whole grains, soy products, yogurt, tofu, and fruits and vegetables. And one of the important things to note is that the food package is inflation proof because we provide this prescription and this food benefit in which they go to local bodegas and supermarkets that have a WIC contract, and they get the items. So when eggs cost $6 and $7 and $8 a dozen on their food benefit card, and the new card is not paper, it's now a card. And on the WIC benefits, you were able to buy your dozen eggs regardless of the cost. So it was inflation proof for the individual. But we also have a very important part of our food package that we need everyone's support in really letting your legislators know. And that's the cash value benefit for fruits and vegetables. In 2010, we had a cash value benefit of $9 for children and $11 for pregnant and breastfeeding people. But since the pandemic, we now have a temporary cash value benefit of $25 per child, $44 to $49 for pregnant and breastfeeding people. And we are at risk of losing that for the next budget year, which starts in October. The important part of this is that this, we call it the benefit bump. This WIC benefit bump is working exactly as Congress had intended, as it's built on a science-based recommendations that really enhance WIC's effective nutrition intervention to deliver healthier outcomes for young children and also for the families. And they've done several studies on this and found that the effects of the WIC benefit bump have been immediate and decisive, with consumption patterns, no surprise to any of us here, that shifted quickly after families had added value to their WIC benefits. And we know that the WIC families want healthier options for their children, and they want an additional WIC investment because that impacts and ensures really equitable access to nutrition foods, and really mitigates the chronic diet-related conditions that our families that we serve have, such as obesity and diabetes. So as we grow this healthier next generation, it's critically important. When we've changed the WIC food package, we've also changed the landscape of the marketplace across the country, but as far as I'm concerned, very, very strongly in the Bronx. You know, we have a lot of bodegas here. And before we change the food package and hopefully change it again, it was hard to buy healthy fruits and vegetables from the local marketplace. They came complete with fruit flies. You know, they weren't fresh. You couldn't find whole grain breads. The tofu, forget it. You know, so now that's changed because there's a demand. Moving very quickly, hopefully, to the next pillar, it's nutrition assessments and counseling. And this is the core point of our program. We're the only federal food program that has the tailored nutrition education and counseling and assessment as a core program function. And this provides really a consistent touch point for families to receive guidance. And what does our individualized participant-centered counseling and assessment look like for our families? Well, it's one-on-one counseling by a RDN or by a bachelor or master's level nutritionist or a lactation consultant. It's group facilitated discussions, it's cook shops, FitWic, many, many breastfeeding activities. And we also work very closely with our healthcare providers. I am located in Gotham Health, Morrisania, so we are in a health center and we just are totally integrated in the care. And the one big thing that has changed in the past 3.5 years is we now provide remote services. If you want to come in for individual services on site, you are more than welcome. But we are finding our families really love the remote services. It's really been transformative for our families. And I see my time is running out, so I'm going to rush here and have time for questions. I can't ever have anything without talking about breastfeeding. Breast milk is the first food. Breastfeeding is the one thing that's a great equalizer, regardless of your zip code, race, ethnicity, economic status, social determinants of health. Breastfeeding gives every baby the best start in life. It's an equitable start, and it's really very important. Just because breastfeeding is natural doesn't mean it's easy for every parent and every baby, and that's where we come in to help. And we need more breastfeeding support now than ever before. The individualized counseling that we provided by our professionals, including board certified lactation consultants, make a difference, not only immediately for the life of that mother and baby now, or that birthing person and baby now, but it's a lifetime impact. And I think that breastfeeding is pretty much the only thing that does that. This is a Bronx Health Reach event, so I can't not mention that we have a wonderful baby cafe funded by Bronx Health Reach and the City Department of Health. We're looking for funding so that we can continue it. Otherwise, we're not able to continue it. It's a drop-in place for pregnant and breastfeeding individuals to get professional lactation help. And the WIC program, the fourth pillar, is on referrals. We screen for a range of health factors, and we make many referrals in many organizations that have WIC. The WIC program is a gateway to primary and preventative health care. And again, we have many, many partnerships, including Corbin Hill Farms and Bronx Health Reach. Innovation is coming. We're talking about online shopping and remote WIC. Stronger outreach from the federal level and data collection. If you want some information just about New York, I'm happy to share this with Bronx Health Reach and they could send it out to you. And sorry if I went over, but we are all in this together. It is critical that we let our legislators know how important the WIC program and the WIC food package is, because we are at risk of getting significant cuts. Thank you.
Thank you so much, Theresa. Yes. So just without further ado, last but not least, we have Aleyna Rodriguez.
Hi, everyone. Thank you so much for having me today. I'm Aleyna Rodriguez, and I'm the ED for the Mary Mitchell Family and Youth Center. So I'm going to try to keep it brief as I can, because I know we are tight on time, but I do want to talk about some of the programs that we do to promote nutrition education, primarily with our youth. So our primary focus at the center is working with youth between the ages of 5 to 12 years old through our after-school program. And in our after-school program, we provide a healthy hot supper. So we don't make any cold meals. We don't provide cold sandwiches. We want to be as impactful as we can, because we know a lot of the families that we serve, this may be their last meal for that day, or a last nutritious meal for that day for these kids. And we want to give them enough to be able to wake up the next day to go to school, and where they're getting their breakfast and lunch. And at the center, we've partnered with Bronx Health Reach and was able to get connected to Lenox Hill, where we got our chef trained to use different items, use different vegetables and produce to make healthier meals. So we have a no junk food policy at the center. And I bet many of you know Heidi Hines, who was the previous executive director here at the Mary Mitchell Center. And she was a strong advocate for healthy eating. And through her, she enforced a no junk food policy. So at the center, we don't allow sugary beverages, chips, fried foods. And that goes from the youth that walk in to the staff to anyone using our building for community groups or community spaces. So we make that very clear across. And for like example, if a youth does come in and they have it, we'll take the snack from them. We won't throw it out, but we use it as an educational opportunity to then go back to the parents and say, hey, hey, this is why this is not good for your child. This is why we should give them alternatives. Here's some other options. And also at the center with our Food Justice Club, which is made up of teens between the ages of 13 to 17 years old. So that's the group of kids that start to phase out of our after school program. So we try to recapture them where they learn about food justice. They learn about the importance of healthy eating, where our food comes from. They get the opportunity to work at our local farmers markets during the summer, work at our community gardens. And then this year that just passed, we got to do trainings with Chef Wilson. So they got hands-on training by a community chef to learn how to consume healthier foods for themselves, and how to prepare it. So when they go home, they can now pass this knowledge, and they now can be a mentor to their families and to the youth at the center. So it goes in two avenues. So we then have our Food Justice Club do cooking demos with our 5 to 12-year-olds, and they will do the demonstration with them where the kids get to be on hands-on. And it was really wonderful that Bronx Health Reach helped us with that, because we were able to get all new supplies, from aprons to the hats. Like, the kids look so cute. And that gets them really engaged right off from the beginning. And they want to try it because they're seeing there's no lying to them what's in this meal. You're not trying to sneak in chickpeas and green beans. They see it, and they're getting to taste it and feel it and know what it is and know what's in their meal. And it's helped a lot as we've integrated new menu items to our menus for the month. And they're not as reluctant to try something new. Where we will have kids that will take a beautiful plate, like if Elsa made whole wheat spaghetti with some corn or mixed vegetables, they may eat the spaghetti and leave the mixed carrots, vegetables, and cauliflower because they're like, oh, I don't know what that white one is. Right. So it breaks that up. It's like, no, now you know what's in there, and now let's give it a shot. And we even had them make their own dressings, their own salad dressings. So they know what's in there, and then they could put that on top of their veggies. So give it a little bit more flavor just to get them introduced to healthy eating. And that's a lot of what we focus on with our programs. So along with our youth, we also run our farmers markets. So I did mention, like, our Food Justice Club goes in and works at our farmers markets. So one of our farmers markets is La Familia Verde, which was previously ran by Karen Washington before she retired from all the advocacy work that she did in the Bronx for many, many years in the community gardens as well. So now we are continuing that market, and the idea of that market is to really help community members get access to healthy food. So, for so long, we've been saying the Bronx is a food desert, but we have food. It's just like you all have been saying this whole time, it's just not good. Whether it's from McDonald's and the new Popeyes that's on East Tremont that I'm just I still can't believe it, to the supermarkets. We had our Food Justice Club members do surveying, and they saw that our community members do not purchase from our local supermarkets because it's overpriced. And as soon as they get it home, the next day it is expired. And that's not fair to them, especially if they're on nutrition assistance programs. They're managing a specific budget to get them through the whole month. And when strawberries cost $6 to $8, and when they get it in their fridge the next day it's expired, that's not fair to them. So through our farmers markets, we try to keep everything very, very affordable. Pretty much everything on our market is like priced at $2 to make it very easy and simple for them to use their FMNP checks, to use their Health Bucks coupons, and to encourage them, if they have SNAP, to pay with SNAP so they can receive more coupons, so they can continue to purchase produce and keep coming back during our market season. And while our Food Justice Club members are there, they got trained by New York City DOH MH, which is just on Arthur Avenue, right next to our farmers market, on doing sugar consumption. So this was mentioned about the labeling and what we're consuming. We had our teens get trained on what a healthy sugar consumption looks like and what's in our drinks. That even for us, that we were amazed, like, oh my gosh, like, I like my iced tea, I'm thinking there's not a lot of sugar, and you will be shocked how much sugar when you see the bag underneath the bottle. So they created their own boards with coconut water, Arizona iced teas, and Nutri drinks and shakes and things like that. And they put them all on the board with the sugar bags. And then they had two healthy options. There was a seltzer or water that have no sugar to give folks an alternative. And they did this demonstration and explained to people, and they were amazed. And these were young folks talking to older people who felt confident to convey this information because they were shocked themselves that it was just wonderful to get this information out. And when they would speak to them, they would get health bucks to then go shop at the market. So this was a way, and I'm going to wrap this up right now. This was a way how we just kept it going in a circle, that we have from our youngest to our oldest community members all integrating together to learn about healthy eating together, because it's something that we all have to do as a community. So thank you so much. I'm going to continue on this call. This has been amazing information across the board. So thanks.
Thank you so much, Aleyna. We are at time. I do see there was one question in the chat that I'm just gonna throw it out there. I think it's for you, Aleyna. So like, how are participants for the food demo selected?
So we do different types of food demos. So at the Mary Mitchell Center, that's specifically with the youth that we're serving in our community, in our programs. But the food demonstrations that happen at the farmers market is if they come. All they have to do is come along, come to our market, visit us, and they're there. And once they have a good amount of people, they would usually start, at least if they have 3 to 5 people there, they'll start the cooking demonstration. We have a lot of walking groups that come to our markets as well. So I'll put my number in the chat. So if you text me and say, hey, I'm coming by with a walking group, we can make sure to coordinate a cooking demo to be ready for you all when you get there. I hope that answers that question.
Thank you so much, Aleyna. Yeah, so if anybody else has any questions, feel free to put in the chat or, let us know. We were more than happy to make connections here and connect you with the person that question corresponds to. So yeah, thank you for all our panelists, for all the great information and work you guys are doing within the community. And I will pass it on to Kelly.
Thanks, DeAnna, and thanks to our panelists for great presentations and information. It's really exciting to know everything that's going on in the community.